a lot of people that's on the line, and some of them may not understand what is population health. And I'll throw that out. Either one of you can answer or both of you can answer. Just give us an understanding of exactly what is population health.
From my perspective, is a concept that is attempting to transform our healthcare delivery system in a way that pays more explicit attention to not just clinical outcomes, how long people live, and ideally how well people live, quality of life, but also looking at the cost of care. We know that in America, we spend far more per capita than any other country in the developed world. And yet when you look at our health outcomes, from mortality rates to the burden of chronic complex disease to infant mortality, we really do not do that well. So from the perspective of value, outcomes achieved related to the cost of that care, Americans have not realized a system that has really created a lot of value for them from the perspective of prevention and wellness. So population health is a model that attempts to align clinical services with community-based resources, sort of clinical community integration, and usually in alliance with a payer, with an insurer that is partnering with you in a way that can attempt to manage the care of a particular group of people within a demographic, and in a way that can reduce the cost of care for those individuals. And it's a model that attempts to manage more in the community, less in the hospital, less in our emergency departments. And ideally, it's a model that should be empowering people. But it's a concept, one that we're all evolving into and with. But the emphasis is very significantly skewed toward the drivers of health. And we all know ours is a system that has not been well designed to address that.
When you say to yourself that your goal is to create healthier people, it informs what you do. So how do you create healthy people? You create healthy people by creating safe housing, nutritious food, livable wages, gender equity, reduce violence, clean air, drinkable water. That's how you create healthy people. So population health is an approach that says, how do we create as much health as possible for populations? And a subset of that would be narrow health equities, health inequities. And the medical care system is a part of that. So this is why I said I'm sort of taking what Dr. Pettus said and going up a notch, because I agree with everything Dr. Pettus said, but I would put that within a broader conceptual framework that ultimately we care about the health of populations. And once we understand that, we want to put in place the elements that do that. And those elements, which are housing and food and education and income and wages and safe parks, some of those, and perhaps many of those, are outside of the remit of the medical system. So I think the medical healthcare system has a real role to play there, but a lot of it is actually outside of the medical care system. And part of our job, once we understand what population health is to make sure that those who are responsible for housing realize that they are also responsible for health, that those who are responsible for transportation realize that they're responsible for health. And that is a conceptual leap beyond what most people of good conscience, who really are trying to do the right thing in those sectors, recognize as also part of their job.